All right. So welcome everyone to this Maryland BHIPP crisis training. Um, I am the program director of Maryland BHIPP, and I'm going to be just orienting you a little bit to the features of our WebEx meeting today. We have had a couple minor technical issues, so we do have an IT specialist on with us who can help us if needed. Um, so my colleague Grace is going to be putting a pre-knowledge survey into the chat. So if you haven't already completed that, if you could go ahead and take a look at that now, just while we're going over things, and take a moment to complete that. It's just a couple items, and that really helps us make sure that we're doing a great job presenting our content, and we do use that feedback for future webinars. So we really appreciate that. So during today's webinar, you'll have the opportunity to I can unmute you, and you can also put questions into the chat feature, but you won't be able to turn on your video today. So the way they have the WebEx webinar set up, you'll be primarily seeing our speaker today, who I'll introduce in just a moment, and her slides. So Grace and I are going to be monitoring the chat throughout today's talk. And if you have any questions, please feel free to drop them in there. You can also raise your hand. And so we'll be monitoring that. We'll leave some time at the very end for questions. And then at the end of the webinar today, Grace will be putting another survey, just satisfaction and post knowledge, into the chat. You'll also get an email with that. So if you don't have time to complete that today, that's okay. And we'll be putting a recording of today's presentation along with the slides and any resources that our presenter recommends. We'll be putting those on our website for you to access afterward. All right, so without further ado, it's my pleasure today to introduce Dr. Jill Bonenkamp. She works at the National Center for School Mental Health. She's our partner at University of Maryland. And she was gracious enough today to join us in presenting on school mental health and youth crisis response across Maryland. So we're really excited to have her here today. So I will go ahead and turn that over to you, Dr. Bonenkamp, to move forward with your webinar.
Thank you so much, Megan. Hello, everyone. I hope your Thursday is going well today. Thank you for joining us, which in what is, I imagine, a lunch hour. And so I'm so appreciative of your time. As Megan said, I'm on the faculty at our National Center for School Mental Health, which is at University of Maryland School of Medicine. We're in the Division of Child and Adolescent Psychiatry with the BHIPP team. I am a clinical and school psychologist by training, and I work to support school mental health research, training, policy, and practice, and also supervise mental health providers who are providing direct mental health services in Maryland schools. I also work closely with many pediatric partners, and was so thrilled to be joining you all today. So my work is at the intersection of school mental health and pediatric primary care. I do a lot of work with the American Academy of Pediatrics. And so some of the things you'll see today are some things that we've done in collaboration with them. All right, so with that, let me go ahead and get started, and I'll tell you just a little bit more about our National Center for folks who aren't familiar. So we've been around for over 20 years now, initially established with funding from the Health Resources and Services Administration out of HHS, and our mission is to strengthen policies and programs in school mental health to improve learning and promote success for America's youth. We have a strong commitment to doing this through a commitment to equity. And so all of our work we conduct through a racial and social justice lens. We have a close focus on cultural responsiveness and equity. And we know that via school mental health, we have the opportunity to continue to move forward our work in developing and modeling equitable and anti-racist policies and practices. And so we highlight this in every presentation that we do so that you know that these materials that we'll be presenting and talking about are grounded in this commitment, and we are focused on continuing to learn and heal and grow together. All right, so what's on tap for on our hour for today? So we're going to do some overview of talking about schools as critical partners in managing behavioral health crises. We're going to talk about the entire comprehensive model of school mental health. So when we think about behavioral health crises, we think a tiered approach and think of our top tier, our tier 3, or in our public health triangle, that services for just a few. But when preventing behavioral health crisis, we really need to be thinking about our entire model. So a lot of what I'll talk about today is how school systems are doing that, opportunities to connect with school systems, because we also know that you all are doing a lot of this across a multi-tiered system or across that public health triangle. And then I'll specifically talk about resources to support behavioral health crisis response here in Maryland, and also some national resources. So I'll talk about a new program out of the Maryland State Department of Education, the Maryland School Mental Health Response Program. I'll share some resources from the Maryland Health Administration, their behavioral health crisis system, and highlight some training resources that generally focus on school mental health, on mental health in general, and have resources that are specific to crisis management, that are specifically geared for health providers. All right, so when we say comprehensive school mental health, what does this mean? So this is a multi-tiered system of support. MTSS is often the term that our education colleagues use for this, but that is synonymous with our public health triangle. And I'll give you a text definition, but I'll also move to a graphic definition of this, which I think is more helpful. So when we think about a comprehensive school mental health system, it's an array of supports and services that promote school climate and social and emotional learning, so thinking about our tier 1, while reducing the prevalence and severity of mental illness. And these systems are built on a strong foundation of school and district professionals, and I'll flag a number of the folks listed here that these are critical partners in schools that we'll be talking about how to connect with them if you haven't already, all in strategic partnership with students, family, and you all, right? Community health and mental health partners. And so we know that it takes an entire team, school and community-based, to be preventing behavioral health crises, addressing behavioral health crises, and supporting the mental health and well-being of youth. All right, so again, as promised, here's this in a visual format. So when we think about a comprehensive school mental health system, this is the promotion of positive social, emotional, and behavioral skills and overall wellness for all students. And I'll talk about some specific examples of those programs. Supports and early intervention for students identified at risk, and then targeted intervention for students with more serious concerns. And that may be where we think about some of these things when we see behavioral health crises happening at that tier 3 level. So I want to give some more specific examples looks like in the school. What types of things might school communities be doing for all students to promote mental health? So this might be efforts to promote positive school climate. This might be ensuring that we have culturally responsive, trauma responsive school policies and practices, that every time a youth is walking into the school building, every person in that building is greeting them in a trauma responsive way, that we're paying attention to just our students, but our educators, and thinking about mental health literacy and social and emotional learning. So these are examples of things that often fall into our mental health promotion. And when we think about behavioral health crises, these play a really critical role in preventing behavioral health crises, helping to support students to not get to this level, but especially when we think of students who may be at risk for a behavioral health crisis, especially this beginning point here, if we have things in place where when a youth is walking into a school building, the way that that youth is greeted has huge implications for what that might look like. They may be in a position where they are on a verge of behavioral health crises, and we have the opportunity at this universal level to turn some of those around and really use that as an intervention point. So I really stress that this is not just for sort of bigger picture prevention and making sure that all youth are supported. That is critical and key. But also when we're thinking about mental health crises, this is an entry point for us to really de-escalate and to make sure that we're being as supportive as we can to try to mitigate some of that risk. And then we have a number of interventions that we think about as we move to tier 2 and tier 3. So this is where we're thinking about mental health supports that are delivered in schools that specifically address mental health concerns that help us to prevent some of those behavioral health crises from happening. So thinking about students who have experienced trauma, who may be at risk, making sure that they're receiving these services. And many schools have some of these things in place. Not all, not every school, but these are the types of things that you can ask about, think about, and is critical to know what's happening in your school communities, and that many schools may be a referral point. There's huge variability here in our state, across the country, but really these are things to think about as potential options that might be happening in the schools. And this is just an example to show that while there are many of these things happening in the school building, that there may be other partnerships that are either community partners that are coming in to provide services or community-based services. And I'll also give a plug as I talk about this sort of whole continuum of support that BHIPP has wonderfully mapped this. And so if you're looking for additional supports for youth, I hope you've reached out to the BHIPP team. If you're here today, you probably have, and you've probably had a good experience, but I just want to flag that they have a wonderful sort of comprehensive list of what is available, and they are familiar a lot about in schools, different schools across the state. Okay, and then so for folks who are not as familiar about comprehensive school mental health, I just want to give you some of this plug of why we've got lots of data to show that youth are 6 times more likely to complete mental health treatment in schools than in community settings. And the benefits are just wide ranging, right? In terms of academic outcomes, behavioral health outcomes, things that we think about in terms of success for youth. If you want to dive deeper into this idea of comprehensive school mental health, this is a great resource. It's about a 6-page document that really sort of goes over why, the value, and then shares some specific opportunities, local and state spotlights. And we can definitely make sure all this is, as Megan said, on the website for y'all. And I'm happy to drop this in the chat afterwards as well. Okay, so as I mentioned, there are things happening in schools, and some folks may say, oh yeah, we've got a great connection with our school. I already know the director of Whole Child, and we're always talking and connecting. And others may say, oh, I haven't quite connected yet with my school, and I know maybe they have some things, but I don't even sort of know where to get started. So these next slides I'll present were from an echo that we did with the American Academy of Pediatrics, and really just are sort of your basic, how do I even get connected with our school teams if this is something that you are looking for and needing to embark on. Of course, these slides are available, so don't feel like you have to jot down or memorize any of these positions, but you could consider connecting at the district level, and here are some examples of folks that you could look for and reach out to. Or if there are a couple local schools, these are folks who may lead those efforts at the school level. So great. Okay, I know I looked up on the web, there's a school psychologist at the school, but I'm busy, they're busy. Like, how do I even get this started? And we've often heard that many folks rely on their office manager even to start these conversations, to sort of do that initial outreach. And these are some example questions. What can we do to support your efforts? And really, this is a place for connection. How can I connect? Are there ways that we can combine efforts? And so these are just some example, questions that you could call, ask, email in reaching out to school teams. I also just included some of our acronyms that we use in schools a lot and maybe aren't as familiar with in our healthcare setting. I can imagine if folks are on this call, you might know a fair amount of these, but I wanted you to have these for reference. MTSS is that public health triangle that we often talk about, and just this additional list I wanted you all to have for reference as you're thinking about connecting with school teams. So a great resource that has come out of the American Academy of Pediatrics that we did in partnership with them is a look at 7 high-performing districts as it relates to comprehensive school mental health. And this report really gives a deep dive on how they do this, how they make these connections, and specifically talks about the role that pediatricians are playing in those high-functioning systems and opportunities where they wish for additional, where those high functioning districts are saying, even knowing that we have partnerships with pediatricians, this is where we really would wish to expand our work. And so this is some of the examples of those action steps that have come out of that report. So this idea of thinking about opportunities to create and cross-promote shared professional development opportunities, thinking about just making those initial connections and developing resources for a common language for key areas of mutual concerns. There are lots of suggestions here. This is not in any way meant to say you need to do or think about all of these things, but rather, here are some ideas. Think about a small starting point, and it may just be, I'm going to ask my office manager or a nurse on my team to look and see, who is our school psychologist? Does he or she have an email address? Could I even start to reach out and look at that? And I welcome for folks to share who already have connections with their school teams. Any, sort of great successes you have there, any suggestions? This is, we want to get the wealth and wisdom of all the folks on the call too. So please feel free to share any of that in the chat as well. And then of course, thinking about your American Academy of Pediatric partners who are very interested in this work, advocating for this work, and lots of opportunities to get involved. All right, so thinking about that overview, now let's get really specific about managing behavioral health crises in schools. What does that look like? What are schools doing? What are partnership opportunities? So schools are paying attention to the fact that we should really be reducing punitive disciplinary strategies and instead thinking about increasing positive climates that improve school safety and prevent behavior problems. And that school systems want to be thinking about a positive approach to promoting student success and to promote school safety. So this graphic actually comes out of a paper specifically focused school safety. So how do we think about ensuring that schools are safer places? Not relying, our data shows us that we don't want to rely on those discipline strategies, but really what we need our school systems to be doing is early access to comprehensive screening, ongoing coaching to ensure that folks at every level are thinking about this, and effective teams that include community mental health partners and health partners. There's a great document here out of the U.S. Department of Education. This is a long read, but I, of course, put it in here. But again, this idea of when we're thinking about safety and crises, our way to prevent those and to adequately address those are by setting up our systems to try to decrease those and be able to respond in a fair and equitable way. So Baltimore County Public Schools graciously let me share this slide that they presented recently on a learning community with other school districts across the state. And it's an amazing example of not just thinking about behavioral health crises at Tier 3, but really thinking about what can they do for all students that may be more at risk, and then at that Tier 3 level. And as you can see, they have numerous programs that are in place. They wanted me to share that this is evolving. They're always looking to add programs, to look and see what programs are working well and which ones they may want to tweak. But there's lots that different school systems may be doing that would be great to get connected about, right? If you have a youth in your office who's sort of repeatedly coming around behavioral health crises, a great place to start is what's happening in the school, what's available, what's supporting them, what might be areas for improvement in that support in the school setting, and what resources might they have not sort of accessed yet that might be available. So there are also lots of great resources, and I wanted to introduce this new program called the Maryland School Mental Health Response Program. So this is a new program out of MSDE, and its goal is to support school systems to address student and family mental health concerns. So while you all have BHIPP, this wonderful program that you can come to for mental health questions, this is sort of a similar model that school systems are able to connect with this team that our National Center for School Mental Health has partnered with, to really think about increasing supports, building their systems. And so I want you all to be aware of it as well as an additional resource. So, and knowing that school system may be connecting to this team. Again, the more we can do to sort of streamline our supports, the better. So I'll just give you a brief overview of this new program. The director of the program is Mike Mumford, and I'll share his contact information at the end. He would welcome opportunities for pediatric partners to reach out. So he and his team work closely with school systems and are continuing to help to build their resources. And the more we can sort of make these connections about what's available in the community, what our community needs, and how we can sort of think about, overlapping here, the better. There's also a wonderful child psychiatrist who folks may know as part of BHIPP, who also supports this team, Dr. Jeff Bostic. He specifically has done a lot of specific case consultation work for high needs mental health issues. So students who may be in the school mental health system, and the teams are saying, we need additional supports, we really need additional consultation. He's been doing that work. And so odds are they may be similar youth that you may be seeing and saying, we wish we had additional supports, but there's not much in our area. And so this would be a connection that you could make. You could start with reaching out to Mike Mumford saying, this is, where the youth goes to school, like this is our connection point. And of course, Megan and the BHIPP team can make these connections too. You can say, I heard about the Maryland School Mental Health Response Program. I want to make sure we're making all of these connections that we can. And this is just an overview of sort of what this program is looking like, including, very specifically is a lot of consultation to school systems to help them build that comprehensive school mental health system. And so you can see that there's consultation and training happening. These are also opportunities in that in the AAP slides about what are opportunities for sort of cross-training options. We've got lots of trainings that are happening as part of the School Mental Health Response Program. We welcome, just about anyone to join those. And so there could be opportunities there if you would want to be connected to hearing about the opportunities. Megan and I and the BHIPP team are continuing to be in contact to continue to think about how we sort of cross-promote and share these opportunities as well. So if you're well connected with BHIPP, you'll certainly hear about these options as well.
Dr. Can I jump in for just a moment? We've had a couple of chats, so I just wanted to pause you for just a moment. So someone was wondering and wanting to hear more about pediatrician partnerships. This was a couple slides back, I think. School mental health pediatrician partnerships.
Yeah, so I can give some examples of what this looked like. So we ran a national learning community with the American Academy of Pediatrics. We had 10 school districts across the country who were intentionally making connections with their school mental health team and a pediatric partner in the community. and get started with just what I had on some of those slides, some initial phone conversations. What does the school even offer? What does the pediatric partner typically offer? What is available? Making some connections on shared cases. And our pediatric partner shared that it was so helpful to have a deeper dive on exactly what's happening in the school system. So if they knew that there was, a small group supporting students who, I think I saw a question come through, who, were having trouble with social or having bullying issues, knowing about some of those connections and knowing about those programs was really helpful. Similarly, they love to have someone that they could call or email and say, just a direct contact. Hey, this is what I have going on. Do you all have anything that might be able to support? And similarly, the school system said the same thing, that they sort of didn't know exactly how to get in contact with the pediatric partner. They knew that they were busy and that they had, a lot going on. And so they learned, either that an email was the best way to go or to connect via through someone else in their office. So I hope that answers a little bit, but feel free to clarify if there are other questions, or ask me to clarify if there are other questions.
I'll continue to monitor the chat and try to save some of these for the end, unless they're about like a specific slide.
Great. Okay, sounds good. So this is was just some example of some additional training options that are coming through the Maryland School Mental Health Response Program. So, again, please feel free to reach out. I think in one slide, I have Mike Mumford's contact information. You certainly can reach out to BHIPP and say, hey, I heard about this Maryland School Mental Health Response Program. Are there any training opportunities? How do we get it? And then these are outcomes that I'm sure are similar outcomes in your buckets around increasing student and family supports and ensuring that our systems are working to support youth and families. Okay, so if you want to get in touch and hear more about the program, please feel free to reach out to Mike Mumford. He's great. He welcomes anyone reaching out, and even just to say, hey, Mike, I want to get connected. Jill, talked about the program and anything related to Baltimore County or St. Mary's or wherever you are. Keep me posted on what's happening, any resources, any ways we can be connected. So I also wanted to flag some resources that were shared by the Maryland Department of Health around their behavioral health crisis system strategic framework. And they are doing tremendous work in building this system, continuing to think and expand their response system. And so this is the framework, this is the vision. Some of this is in place, some of this is continuing to be developed. And I share this to also think about them as a resource and to know whether you know some of these different resources in your area. And if not, that they are a great place to reach out to find additional information. And to save you a step in that process too, I know that BHIPP has a lot of this mapped. So this is a great question and outreach to Megan and team too for some of these additional behavioral health supports. I also just wanted to make sure folks are aware that there's this wonderful 988 toolkit. And this is a great resource for you to be familiar with, but also if you want to have in your office to share with families, that we've had this national launch of the National Suicide and Crisis Lifeline, and Maryland is in the process of rolling that out and has a number of resources that are available for you to be familiar with and to share with others. And this is just some example of what some of these resources look like. They also have some great, sort of digital pieces that, you could consider having in your or sharing with others. All right, so another resource that I wanted to talk about, some of these things are okay. How do we connect with schools around behavioral health crises? What's available across the state? How are we sort of making all of those connections? This is a great resource that I always share as anytime we're thinking about about mental health, and especially when we're thinking about school mental health and behavioral health crises. So the mental health training intervention for health providers in schools was developed by our National Center in partnership with BHIPP and several other partners, the National Association of School Nurses and the Center for Mental Health Services in Pediatric Primary Care at Hopkins. And this is an online course that is an in-service training for school health professionals, but really for any health professionals. So I presented a lot of this material part of the American Academy of Pediatrics ECHO that I was a faculty on, and folks said, "Oh gosh, where did these slides come from? What is this? Is there more?" They said, "This is a whole free online course," and so I just want to make sure folks were aware of this. Many of those pieces in Skills and Practice 1 and 2 are very straightforward mental health intervention skills that we have specifically designed, and they're evidence-based strategies, common element skills that then have been tailored for delivery in a health setting. So there's very specific resources for how to do some very basic cognitive behavioral work, how to think about youth that have symptoms of anxiety, depression, behavioral disruptive behavior concerns, and so lots of resources in here. And again, this training is free, is online. It's a nice interactive format. There are presentations, there are vignettes of role plays of folks sort of acting this out and going through what this would actually look like for youth in sessions. And so we'll make sure you have this link as well. We can drop this in the chat, but I just wanted folks to be aware of that resource as well. We've found, folks really find that you can do it at their own pace, can select which modules, sort of go in and see what may be of use and go in there. So I wanted to make sure I left plenty of time for additional questions that are coming in, and happy to answer anything that's in there or new pressing things that you're thinking about.
Thank you so much, Dr. Bonenkamp. I really appreciate it. That was so much good information. We have had a few questions come in, so let me go ahead and pull those up and I can read those aloud. Okay, so someone says, I feel that a lot of kids need to be monitored if they're a regular target of bullying, as the bully has major behavior issues. The kid that's always targeted most likely has more emotional issues, and that is the ones that get pushed aside per se.
Yeah, this is a great question, and I love how you acknowledge that there are two youth or multiple youth that are involved in this, sort of thinking about, both that perpetrator. I also hear sort of an externalizing, internalizing, that oftentimes, in a busy school building, youth that are having more externalizing behaviors, or that we see those bullying behaviors, may be receiving more attention than, we know this, than youth that have more internalizing anxiety, or maybe keeping emotional issues that might be a result of that bullying to themselves. We stress a lot the importance of thinking about mental health screening and thinking about, how do we ensure that we're not missing those more internalizing concerns. If this is a specific case that you know about and are aware of, this is a great point of partnership and advocacy at the school level. This would be a great point to reach out to that school psychologist or that school counselor and make some connections there. I think schools are continuing to work. There's huge variability in what this looks like. Some schools are doing it really well, and so there may be additional resources there, and some schools may still be building it, and there's opportunities for you having this expertise and having this insight to be able to bring that to the school team. May sort of be aware of this sort of repeated bullying behavior and may know less about what you're seeing in your office or hearing about sort of that significant emotional toll. And you have that opportunity to really advocate for that student.
Mm-hmm. Thank you. Another question Can the student be involved in individual therapy and still be referred to Maryland School Mental Health Response Team for additional support for the family?
Yeah, that is a great question. So, in short, yes. So, the Maryland School Mental Health Response Program does not bill for services, and I want to make a clarification that they do not provide direct services to youth. They are a system support. So, what could potentially happen is if there's a youth that's receiving services and you're seeing them and there's still kind of this need for additional support, this is what we refer to as a complex case. That's where the Maryland School Mental Health Response Program could pull in Dr. Jeff Bostic or one of the other folks on the team and be an extra point of consultation. I think we have about 3 or 4 districts that are using this and love it. I actually was just talking with Dr. Bostic, and many times that sort of additional consultation, additional set of eyes has had some real success in terms of turning that around and making some forward progress, or is a continued source of support for some of these more complex cases where we just sort of need to continue teaming on them as we're working through. So that was my long-winded answer to yes. Even if a youth has lots of things going on and is billing insurance or already receiving services, definitely you can reach out to the Mental Health Response Program.
Great, thank you. We did have a follow-up question in regards to the earlier question about pediatrician and school partnerships. Somebody was curious about student specific instead of just referral sources. The pediatrician. I'm sorry, I'm trying to understand your question, Trina. I want to pose your question. Okay. Unfortunately, it doesn't look like I'm able, unless Zach, you're aware of a way, it doesn't look like I'm able to unmute the specific attendees, which I did try. Let's see here. I'm sorry, Trina, I'm not able to take you.
I'm able. Can you hear me?
Oh, good. Okay. Yes.
Great. Thank you. Thank you. So I'm sorry, I'm confusing in my writing. I guess when you mentioned the pediatricians being a partnership with the schools, that really intrigued me because I'm aware of behavioral health partners. And so my question in follow-up to what you shared previously, is it more student specific that you partner with with the children or with the pediatrician, or is it more that the pediatricians are like a referral source, consultative partner within the school? So I was just trying to get more understanding in regards to how you use the pediatrician within a school system. Thank you.
That's a great question, and thank you for clarifying. It's hard to get all of that into the chat, so thanks for coming off of mute. I'll say all of the above. I think we are, an American Academy which is so interested in this, and folks across the country are, because I think we are just really starting this meaningful work. Of course, I can imagine there are folks on this call who already have partnerships with schools and are already doing this, but all of the above. So we've seen schools really looking to the pediatrician for that consultative advice. In this learning collaborative that I taught, that was something that for instance, a school counselor or a school psychologist said, we didn't know anything about the medication that they were on, or we didn't have an understanding of some of the complexities here. And it was so nice to have this consultation and be able to talk directly with the pediatric team and the pediatrician. And that was, sort of using the pediatrician as an expert for specific cases. We also have heard the pediatrician and the school system say, so valuable that we were on a team together, that when the school system was thinking about what supports do we want to ensure that all students have, having the pediatrician say, well, this is what I see coming through my office, and that I think would be really valuable. And I didn't even know that was possible, that you could, sort of do XYZ. And I think that would be valuable. Or can you do anything like this? This is, what I would wish for. And that's perhaps just the beginning of, those are just a couple of examples of opportunities there. So I would say, and you'll have the slide deck, we put some of those sort of beginning the conversation slides, but I would say it's sort of open. You all are serving the same youth, working together, promoting this similar goals here, right? You want the youth that you're seeing in your office to be thriving. They want the youth they're seeing in schools to be thriving. Making those connections, there's sort of endless opportunities to really, be moving this forward.
Mm-hmm. And, in terms of our role at BHIPP, as provider to provider consultants, a lot of times we're recommending to, pediatricians and other primary care providers to reach out to the school, recommending that they get a release so that they can communicate, or they can attend or send someone from their staff to attend meetings on behalf of students, things like that, and providing consultation to them as well on kind of like what to look out for on the behavioral health side. If a family's coming in and the child is having symptoms, what could be going on and how they can partner. It looks like, oh, I'm sorry.
Go ahead. No, I was just saying, I love that. So many ways that BHIPP, I think, can really your initial connections here with school systems. So amazing.
We have a question. Someone is wondering if these services are available to private schools as well as public school districts.
Yeah, so it's a great question. So this, this model of comprehensive school mental health, we wish for every school to have. And as you can imagine, it's complicated in terms of how that's funded and how schools do it. There's a lot of different ways that it's funded, but I mean, certainly we see private schools who are in some position, have different sort of ways that they fund this, but similarly are looking to have that public health triangle, that multi-tiered system of support, and many of them do lots of great work around, especially that mental health promotion, and then ensuring that there are additional supports for students. So yes, if youth that you work with that are primarily going to private schools, definitely consider that outreach to those schools as well.
If other folks have questions for Dr. Bonenkamp or even myself around BHIPP, please feel free to drop those in the chat. Do we have information on how many schools have this tier system utilized in the state of Maryland?
That's a great question. So the Maryland State Department of Education is really dedicated to this, and hence this new Maryland School Mental Health Response Program and a number of other initiatives at the state level. And then there are many, many things happening at the district level. What it looks like varies across the state, and many school systems are working to, sort of continue to build what they have available. We connect via the Maryland School Mental Health Response Program. We connect directly with the 24 school districts across Maryland, and all of them have some portions of this happening, and all of them are really committed to growing it. And the state superintendent, all the schools, are really focused on this, continuing to be more focused on this as we see our youth mental health crisis continue. And so that Maryland School Mental Health Response Program, Mike Mumford, is a good point of contact to reach out and say, hey, I'm in this school district, would love to just better understand what's happening, or who's the person I might connect with at the district level. So that's the other thing too. They've, sort of mapped, and we have monthly call district leads. So instead of you having to dig around and do that, you can definitely reach out to Mike and say, I just really would love to know who is a lead at Baltimore County Could I reach out with that to them? What would you recommend? What types of things do they have going on? And yeah, sorry, again, I have a long-winded answer of these questions, but none of it is as simple as a number or a yes or no.
Okay, looks like we have another question. Are there mental health supports in place to support the teachers within this framework? Or is there a program that works in conjunction, as oftentimes they may be the first line of defense to implement interventions or report behavioral concerns?
So all 24 districts across Maryland have a huge focus on thinking about staff wellness, and nationally, there is. And similarly, it's variable in terms of what is available. So we've seen some really creative and innovative things happening where employee assistance programs, they've bolstered those programs to support educators. We've seen places where they're really intentionally looking to build mental health supports for teachers in schools and all administrators in school. And so it's really sort of district specific, but it is certainly a focus. And so that's a great question to ask too, is, what types of things and what opportunities do we have? This might be something you want to build for yourself and your team. Could we partner on, some trainings or some supports for, for our adults who are on the front lines doing this work?
Any other questions, folks? Some compliments for you. Thank you for your insight. Great presentation. Lots of thank yous.
And I'll just share too. I have my contact information here. As I said, this is work I love, is this intersection of school mental health and pediatric primary care, and I think we have lots of opportunities. So if this is also a passion for you and you want to chat more or connect more, please feel encouraged to email me. You can also check out our website, schoolmentalhealth.org. We have a listserv you can sign up for. We send out announcements twice a month, not too intensive, but to be connected with us and hear about any other opportunities.
We have another question here. Is case management and peer recovery support integrated in school mental health care?
It's a great question. There's definitely some of this happening. And I've seen via case management some amazing work that happens with our school nurse teams as it relates to that, and partnerships with school nurses and school counselors. So there's definitely that happens. It's, school to school specific. And some of that peer work, I think, is another avenue that folks are continuing to look to build. We have another national learning collaborative where we're specifically focused on that youth piece and how youth are informing these systems and playing an active role. But there's lots more opportunities. And actually, that has been a huge piece of just excitement and is great to think about for youth that you interact with, especially adolescents, that do they know their school counselor? Is there an opportunity for them to be involved in a leadership role there? Not just connecting for services. We've seen youth, really just having such a critical perspective and innovative, ideas, and so sort of knowledgeable about what this looks like for them and for other youth, and really being powerful in terms of that. I think great place that you could be talking with patients, and especially for adolescents, and really empowers them as well. Asking those questions, whether they know the school counselor, what mental health supports look like at their school, etc.
Okay. Is there a resource in Maryland that maps out social and emotional learning skill building for teachers to incorporate in the classroom?
It's a great question. I'm trying to think it's Maryland specific. I would say there probably is, and Mike Mumford, via Maryland School Mental Health Response Program, would be a good starting point to ask. There are tons of national resources for this. So CASEL, which is the Center for Advanced Center for Collaborative for Academic, Social, and Emotional Learning, CASEL.org, has a whole sort of clearinghouse of some programs that are free, lots of free resources that they have, and opportunities for teachers. But that's a great question point again for the Maryland School Mental Health Program. Like specifically, if you wish to know for one school, what could you recommend or what might be available, that would be a great, and that Maryland School Mental Health Response Program has done some of that work at the school level and sort of done some consultation if that's something the school really wants to build, that's a great place that, that program could help to support them.
Great, thank you. I just dropped that website into the chat for folks that want to check that out, thecastle.org. We have another question or comment, I guess. Caitlin Helwig says, I work for Dorchester County Public Schools in Maryland, and we use Move This World, an online program at our schools. Are you familiar with that, Jill?
That's amazing. And, there are so many of these, and it's so useful to have one that, has been vetted through a school system. I've heard of that one. And yeah, many of these are online. The CASEL website is great because you can sort of vet them and see, sort of what the evidence base is as well. And again, rely on, we've got this whole team at the Maryland School Mental Health Response Program, say, we'd love to be able to share stuff with our school system. What would you recommend? What are a couple of different programs, at the elementary, middle, or high school level? That's definitely some, an ask that is right in their wheelhouse.
Mm-hmm. Great, thank you. We have another question. Who would you suggest a parent contact in a school district if they feel like their child needs support in school?
It's a great question. Okay, so I typically, there's two places I would start. So sort of two places to start. Of course, the classroom teacher, because sometimes the classroom teacher is kind of connected with, we've got a great school counselor, great school social worker, or school nurse manages a lot of this. So that's always a good point. Sometimes folks wish for a first contact to be outside of the teacher, that maybe, they sort of want to reach out to someone else besides the teacher. So looking on the school website to see if there's a school counselor, a school social worker, or a school psychologist at that school, that is typically, a place, a content. So the sort of local mental health professional. I'll also put one other plug that some school systems also just on their homepage, or have a tab that says mental health or student support services support. And if you click on there, there's sometimes a central line that you can call to. That's for all schools. So that's a great place. You can, say to parents, check out the home, see if there's a link to any mental health support. Sometimes they'll have an online form or a phone number that you can call.
Great, thank you. And someone suggested their local care team as a great resource. Okay, another comment or question here. SEL curriculums have recently been politicized, and there is some pushback with incorporating SEL. Is there an advocacy or public health arm to your initiative so parents and caregivers can understand more about what SEL is about? Maybe they meant why SEL is important for safety and learning. Great question.
It is a great question. And so CASEL really has led this work, and they have amazing resources. I think their tag phrase is stand up for SEL, and they have a whole section on their website about that, and how parents and community members and health partners can really effectively advocate for the importance of this. And I know when I talk about SEL, right, that any of our acronyms are hard. What do we mean when we say social emotional learning? I often use when the late directors of Castle, Robert Weisberg, did many presentations. What's the one thing that you would wish for all high school seniors to graduate? What skill? What's the one thing? What skill? And no, think for a second what that might be for yourself. I often ask this of folks, but no one ever says math. No one ever says reading. They say self-determination. They say motivation. They say empathy. They say confidence. That's social emotional learning. And group out of California that does a picture of their graduate, and it includes those skills and those traits, and it puts it front and center that we are building life skills. This is about ensuring that all youth are able to adequately go into the workforce and succeed. And so Castle has a lot of this on their website, but I talk about that. What do we wish for our youth to graduate with? I hear people then say skills, which are SEL skills and SEL traits. And that's your, that's your case. And I think it's a great place for, for parents and for all of us to be able to advocate.
I can continue to monitor the chat. I just want to draw everyone's attention. Grace has just dropped our post webinar survey in the chat. If you could please take some time to complete that. You'll need to complete that in order to get your CME CEU certificate for today. If you have to run, if you're going back to work or something, we will be emailing that out, so you'll have another chance to complete that. Let me just make sure I didn't miss any questions here. You're just getting a lot more compliments, Jill, in here in the chat, thanking you for such a wonderful presentation. Very informative.
I know this will be starting to jump off, so I just want to give a heartfelt thanks for everything that you all do. Are superheroes. I'm so grateful for that you do, and especially for this work that you do for supporting mental health and frankly so many other things to support the well-being of youth. So it's my pleasure to be with folks today.
Thank you. We really appreciate it. And judging by all these wonderful questions, I think this was a really great topic for us to cover. Okay. Let's see here. This was amazing. Just making sure I don't miss any questions. I see somebody dropped their email in the chat because the other one wasn't working. We'll be sure to grab that. Okay. Well, I'm happy to stay on right until 1 o'clock. I know some people need to run. Their lunch hour is wrapping up and they may have things to get back to. We really appreciate your attendance today. Thank you for all the wonderful questions. Please visit, the school mental health website. Please visit the BHIPP website. We're happy to be a resource for you, and we'll continue to offer more in the crisis training series. So Grace just put some information. I'll be helping to lead our next training about suicide prevention in the primary care office with my colleague, Dr. Mary Swick. So I'm looking forward to doing that in March, and we'll continue that series throughout the spring. All right, it looks like most folks are logging off. I'm going to go ahead and end the meeting. Thanks again so much, and reach out if you have any questions. Look to our website. In a few days, we'll have the recording and slides posted, as well as any resources that were shared today. Thanks so much.